Hi, I'm Blaise Bourgeois, physical therapist at Body Balance Physical Therapy, and today we're talking about golfers and tennis elbow. So the first distinction I want to make is which is which. Golfer's elbow is an injury to the common flexor tendon on the inside of your elbow, and tennis elbow is an injury to the common extensor tendon on the outside of your elbow. These two injuries get their names from the sports because there's very specific motions in either sport that causes those injuries. With golf, it's this motion coming through the ball where you get your overpronation and wrist flexion, and it damages some tendons on the inside of your elbow. With tennis, you get that injury from the complete opposite motion. So when you go to do a backhand, you get wrist extension and supination, which injures that tendon on the outside of your elbow. Now, just because those two injuries get their names from those sports doesn't mean you can get either injury playing either sport, because you do get those motions. Like in golf, you get it taking it back, you could get that same motion you do with tennis, which could injure you. Or with tennis, when you come on your follow through with your forehand, you get that same motion as you do with golf. Now, either injury is not difficult to treat. It's actually very straightforward and very easy to get better. You just have to do the right things. And the first thing is rest. If you're having pain, whether it's on the inside or outside of your elbow, and you continuously play 4 hours of golf or 2 hours of tennis, it's not going to get any better. It's just going to keep hurting and maybe even get a little bit worse. So you do have to rest. Now, while you are resting, there's a couple things I can show you that's going to help speed up the healing and recovery process to get you back to playing your sport sooner than later. So the first technique I'll show you is called cross-friction massage. And all you're basically going to be doing is you're going to be rubbing where it hurts, increasing blood flow, breaking adhesions, and kind of realigning the fibers where you have your injury. And I'll demonstrate this for golfer's elbow, which is on the inside of your elbow. So if you can see here, I drew the tissue that's injured, which is called the common flexor tendon, and it runs and attaches to the inside part of your elbow. And if this is how the fibers run, you want to rub directly perpendicular to that or across from that. So all you do is you take one finger on top of the other, you get right close to the part where it attaches on this bony part on the inside of your elbow, and you just rub up and down. Be careful not to rub over the skin so that you'll kind of rash and damage your skin. You want to feel the hard or firm tissue underneath the surface and rub on top of that. You can perform this for about a minute or 2 minutes, whatever you can tolerate, and you can do this twice a day. But what I do want you to do after you do this technique, immediately following, is I want you to stretch that muscle so that once we break the adhesions, we can kind of lengthen the tendon and kind of realign the fibers and keep it there. So to do that, you'll just put your wrist in this extended position and you'll pull it back. Now, what I like to tell all my patients when they're doing a stretch is that if you just kind of push and come back and forth, you're not getting any lengthening of the tissues. To really get the good benefit of a stretch, you have to pull it to a point of where you can tolerate and good resistance, and you want to hold it there for at least 30 seconds. And people do count fast when they're doing this, so I always say 45 seconds to make sure we get the full 30. Thanks for watching. If you have any questions, please post a comment. You can also go to our website at bodybalancelakeWay.com, where you can download a tip sheet on golfer's elbow, tennis elbow, or other common golf-related injuries.